Yes.
Government partners, chairman, councillors and staff of the Western Area Rural District Council, members of the diplomatic and consular corps, leadership and members of all political parties present in Parliament, the headman and other community leaders of the Keritam community, management and the entire team of Eastside Group, Your Excellency the Lebanese Ambassador to Sierra Leone, Mr. Habib Jabbar, colleagues from the Ministry of Health and Sanitation and other MDAs here present, traditional leaders here present, leadership of the security sector of Sierra Leone here present, distinguished ladies and gentlemen. Please permit me to briefly introduce our chairman for this program. Your Excellency, distinguished ladies and gentlemen, our chairman this morning is a man who was born in Freetown, though he hailed from Thailand, the only district where there is only one lane, politically. He is a gentleman married with 2 children. Educationally, our chairman attended the Methodist Primary School, Dodo Potuma, Thailand district. That's the only smaller village under the most important town in that area called Nyadumambahu, also Thailand district. Of course, some people want to hear or know the school this chairman attended. Of course, the Noble Home School. He attended the government secondary school. He also studied in Romania, where he graduated as a medical doctor. 3 years later, he also gained a Master of Science degree at the prestigious London School of Hygiene and Tropical Medicine. He has served as president of the Sierra Leone Medical and Dental Association. Our chairman has also served as medical officer in several districts across the country, including Ujaun, Bo, and Western area. He also served as the Chief Medical Officer, Ministry of Health and Sanitation. He has also served as Director for Disease Prevention and Control Program. Of course, our chairman, before attaining the position of Chief Medical Officer, served as Deputy Chief Medical Officer in charge of public health from 2015 up to 2018. Our chairman, Your Excellency, our chairman is currently the Deputy Minister to Ministry of Health and Sanitation. Your Excellency, Cabinet Ministers, distinguished ladies and gentlemen, please permit me to present to you a man whom I believe will steer this program to the fullest of his ability. That is Dr. Amara Jambai.
Thank you very much, our PS, very good PS, from the Ministry of Health. Your Excellency, permit me to stand on existing protocols in order for us to participate other activities that you have ahead of you. Ladies and gentlemen, today we are here I've been asked to welcome you to an environment that we have destined as a place to get health care and a place that the ministry should move into the future. We have noted that many things that start off well always start with some tragic beginning. It was here that 2014, Your Excellency, one of the first Ebola treatment center was established by supported by GP to Save the Children as the operational arm. It was here our colleagues, Dr. Aliburi and Dr. Bashtaki discovered this place. They came here looking for a premise for us to work on. We must say that dream is what you have come to make a reality today, because it takes a presidential push for us to realize the dream of creating a health village here. Already, as you can see, Vodafone has invested in this location. We had here to create a medical drugstore. We have here a blood bank. We have here other plans that we believe can make the ministry what we want it to be, like with your vision, Excellency. We are here also, and the truth is, you are the ones starting the first push for us to create this health village, for us to establish a 150-bed hospital, a hospital that will have a receptive outpatient department and feel warm and be treated, a hospital that we believe can reduce the burden of us spending out, because the Excellency, last year alone, you approved 16 million for treatment overseas. We have the opinion that this entity that we are about to launch today, we add value to that. We want each and every one to know that it has been our dream, and it has been a pet project that our Minister of Health has grasped and has moved along with it. We want to say also that in our coming here today, ISAD is going to help us build a state-of-the-art 150-bedroom. Your idea of bringing in the public sector into governance. Let's get this. In the US alone, 74% of what the country does is from the private sector. In Sierra Leone, it's about 26%. So we are farmers, we are inverse. It's telling you that the only way we can sort of progress is bringing the private sector to do many of the things we cannot do efficiently. So, this is a dream, and this is the beginning. We believe this is the way forward. This is the direction that this country should take. Let's bring on board the private sector. Let us do more. Our people deserve more. We have to thank people. Ladies and gentlemen, for us not to, many are going to speak. Let me end my subject here and to say this is a new dawn, and we are happy that we are launching this program today, and we want to make sure that there will be a demographic shift. So many young men in our society. So I'll tell you this place is going to boom, because all of a sudden, once the president, our president, launches this, people are going to start coming around here. But let us plan well, because if we plan well, this is an ideal zone for us to get health care. And tourism, not very far, is another option. So let us plan well, based on what we are going to do today, to make sure that This, as you can see, ecotourism is topmost in this place. The serenity that is provided by this place is, you cannot get it elsewhere. So, the country of ISA, I want to thank you very much and say we welcome you into the healthcare development of this nation. Thank you, ladies and gentlemen. Whatever we do goes with parliamentary approval. And the man that is always with us is Honorable Joki. Honorable Joki, please come to you. Because when we go to the parliament, we want an all-inclusive way forward. Thank you.
Thank you very much, Mr. Chairman. Mr. Chairman, Your Excellencies, retired Brigadier Julius Maravio, the Vice President of President Carlo, in absentia, and of course, all protocols of that, not forgetting the leader of Parliament. I say good morning to you all. On behalf of the Honorable Speaker, Honorable Dr. Abbas Bundu, who is not with us here because of certain reasons, I would like to convey, of course, this kind of sentiment from the legislative arm of government and the Sierra Leone Parliament. Your Excellency, all the districts present here this morning, I would like to register my thanks and appreciation for the opportunity given to me as the chairman of Parliamentary Health Oversight Committee to actually say a word of truth and this all important gathering. I would like to start by commending the government of Sierra Leone, led by His Excellency Dr. Julius Maravio, and for this laudable venture you have undertaken. I also want to say thanks to the Sierra Leone government for this opportunity which we are going to have here when we are coming to Sun request by His Excellency the President. I know very well that this opportunity is going to lessen the burden of Sierra Leone as it comes to reality. The health sector, of course, is a key indicator for the holistic growth of any nation. Therefore, an investment of this nature is a laudable one. I would also want to appreciate the East Construction and Development Limited for securing funding for this project over a 16-year span with a 3% interest. And also for providing design appropriate to the architectural character of the neighborhood, notwithstanding and also importing all the required equipment for the targeted delivery of quality health services as best as possible. Of course, as the chairman started saying, this facility, when built here, will put 150 beds for inpatients and also 40 flats for doctors, with 50 rooms housing for nurses, a full cardiology department. It will also have a training institution within the hospital facility. And it's going to create jobs for up to 200 doctors or even more. And not forgetting people present here, that this facility will also have a food diagnostic and cancer treatment center. This initiative will help in addressing the perennial challenges associated with health diagnosis in Sierra Leone. Most often, critically ill Sierra Leoneans has to be flown out of Sierra Leone in order to carry out health diagnosis and subsequent medication, which also have attending financial burden on the family. As a substantive chairman of the Parliamentary Oversight Committee on Health and Sanitation in Sierra Leone Parliament, and by extension, I would like to commit myself and my committee to ensure that we continuously monitor and convey our oversight activities on this project right from its inception and to the completion, and even beyond. I also want to use this platform to encourage the Ministry of Health and Sanitation to expedite all activities that fall within the ministry's purview and consider this project as your duty. Of course, I will not conclude my statement without encouraging the residents of Kerry-Town to give total support to this project and ensure they serve as community security for this particular project. I thank you very much.
Thank you very much for giving us the commitment and the legality set now. You know, it was intentional. Partners can now come on board once the parliamentary colleague has approved. So, one of our partners, which we all know is been with us for over how many years, and that has transformed into the FCTO. You know, wherever we are, when something good is happening, we want you to be with us. So, Walker, please come and make your speech.
Your Excellency, retired Brigadier Dr. Julius Nadio, in the interest of time, I hope you permit me to stand or post off. My name is Kay Walker Robertson, and as you heard, I'm from the Foreign Commonwealth and Development Office. We're here today representing as chair of the wider Health Development Partners Group. All of the UN partners, all of the country bilateral partners, but today and importantly, it's critical that we recognise the importance of private donors and business. As we stand here on the site of the old Ebola Treatment Centre, which was a true partnership supported by government and by donors, I want to thank you for inviting us to hear about Your Excellency's vision for this new centre and how something so tragic on this site can become so hopeful for all Sierra Leoneans. This event truly illustrates commitment to continuing essential health service planning during the COVID-19 crisis, always with an eye on the future. And I want to commend the government leadership for making it a priority through such challenging times. I believe the confidence. Through the recent launch of the Demographic Health Survey, we have seen huge progress in health outcomes. And with Your Excellency's vision, groundbreaking vision for improving human capital as a holistic and integrated focus on health, education and nutrition, we believe we will see much more progress in the coming years. But we all know there's much more to do and further to go. The opening of this health village is an opportunity for us to reflect on the goals that we have for the coming years and how this centre can contribute to the overall ambition for universal health coverage, as that is where we need to set our eyes now. As development partners, we would encourage the ministry to ensure, as Deputy Minister has said, that this within the wider health system. From staffing deployment and training to the important postgraduate medical training that will be required to have the expertise needed in this kind of facility. As the health donor community, we stand ready to partner with you in exploring these challenging questions over the coming years as you build this important health village. My congratulations once again for this incredible moment to mark the first step in your vision for the health village. Thank you.
Thank you very much, Penny. Your Excellency, November, we did a groundbreaking exercise with partners in Jojima. December, I was with the First Lady at Ibom Military Hospital. We set up another vision for private that the work has started. Today again, this is January. What is happening? Is it every month we do something? It's happening. Every month we are doing something. This is January. Today Easter is because Easter, what have you got in stock for us? Please come to the general public what you have for us.
Good morning, everybody. Your Excellency and the students of the Bible, Minister of Government, Members of Parliament, Members of the Diplomatic Corps, English, ladies and gentlemen. I wish to also especially thank His Excellency the President for his marking the servant of the fourth body consumption of 150 beds general hospitals in Sierra Leone. I am particularly delighted to report that funding for this project for the construction of these hospitals and also for 6,000 housing units has been secured. It is not always easy to convince foreign investors to come and invest in Sierra Leone, but since His Excellency assumed the leadership of our beloved country, His Excellency Dr. Joseph Balladio has worked tirelessly to represent the image of this country. Sierra Leone is now attractive direct investment. Today, Sierra Leone is highly respected in the international community. I want to thank His Excellency the President for his personal efforts and support in getting this project implemented in Sierra Leone. The hospital project, when completed, will provide jobs for 600 Sierra Leoneans. The hospital will have also a quarter for doctors, nurses, and other administration staff members. There will also be guest house for people who accompany their friends and loved ones during their stay in the hospital. There will also be helipad within the confines of the hospital. On behalf of Easy Construction and Sierra Leone Limited, Mr. Elias, stand up. I wish to thank His Excellency President Dr. Julius Balladio and his government, and especially the Minister of Health and Sanitation, for making this dream a reality. When completed, this hospital will cater for the medical needs of not only Sierra Leone, but the neighboring countries of Kenya, Liberia, and even Ivory Coast. Thank you all.
Thank you very much, sir. We are very hopeful and good days are ahead of us for delivering healthcare in Sierra Leone. Now, our Housing Minister is someone who is very passionate about setting up. Since he came to the Ministry of Health, he has grasped the issue of bringing facilities to one place for us to function better. But again, dreams, every night when we go to bed we dream. But when we get up we dream for it to become a reality. I think we need His Excellency every day to do it so that those dreams can become a reality. I think what His Excellency has come to do. The minister has been dreaming. We have also been dreaming that this becomes a reality. Therefore, let us hear from our now Minister of Treasury Affairs, Education, and let us hear what he has for us, and maybe how we can partner in a futuristic manner.
Your Excellency, the President of the Republic of Sierra Leone, distinguished ladies and gentlemen, this is a very, very happy afternoon. We are here specifically to look at the tip of the iceberg within the health sector. We are here to talk about provision of tertiary services. You have been informed that this side would push 150 bed tertiary hospital. You have been informed that that hospital would also have 40 flats for doctors, 50 rooms for some of the nurses as well. It would also have a hostel facility for those that are come the sick. But let us look at the services that we are going to get from it. Today, we send people out to the services, or more importantly, for oncology service and also for cardiovascular service. We do hope that this facility would now have a reversal in the sense that rather than Sierra Leoneans go out to access services, people will come into this country to access service. But let us use the time to think of the privilege, to think of other issues. You know, the year 2020 has been a difficult year. The year 2020, we had the coronavirus. Everybody would say that is when everything stops. And the Ministry of Health, that is when we use the time to be able to come up with so many projects within the year 2020. Let me just allow you to have a feel of what is about to happen. Indeed, His Excellency said, human capital development is education, is health, social protection. We are considering now the health service. You cannot do a lot if there is a pandemic. The very first project in the ministry in January was that to address coronavirus, in which the World Bank supported us with $7.5 million. Immediately after that, we embarked on the second project, which we call a response to corona, but which indeed we use for health system strengthening. And that is for this, through the Islamic Development Bank. We access another 10 million. I'm going to explain to you how we are going to do that. A third project that also was put together in the year 2020 is again for that for the Islamic Development Bank with regard to reproductive health. That was taken to Parliament just about 3 weeks ago for its 20.5 million. Finally, our friend of Parliament use the position to say we cannot just be talking about what others can do for us. We should also make an investment in ourselves. And therefore, in the supplementary budget of last year, you see a $10 million package by government of Parliament. Let us now put all of these synergies into one and see where we are at that now. During we have been praying for our responses for corona. We have been classified as one of 4 countries in which the world believes we are safe. But within the intervention, we have to use hostels of colleges. We have to use schools as isolation centers. May I say, in the Economic Development Bank project, starting the year 2021, isolation and treatment centers will be built in all districts of Sierra Leone. A comprehensive response. But through the Renise project, the World Bank has now harnessed a 3.6 million only for us to do one at Lunge. Lunge should be an isolation, a treatment, and an ICU center. A state of the art at Lunge. To complement the airport that we are about to put at Lunge as well. That is the gateway for Sierra Leone. That is why when people want to access this country, we have to ensure we are able to provide the service. So we will not only use the IDD fund to do an isolation and treatment center in all the districts, we will use the EDC fund to look at Lunge specifically. But that is not exciting. Here we are only talking about addressing the pandemic. Let us look at what we want to do in the clinical services in Sierra Leone. Sir, the last 3 months, every newspaper would not advance from the Ministry of Health. Why? We are going to rehabilitate 14 district hospitals in the country. Why? We are going to build 8 what we call 3-in-1. For the first time in Sierra Leone, there will be a dental service in the district. There will be an ophthalmology service in the district. There will be an EMT service in the district. The year 2021 is indeed accelerated delivery for the Ministry of Health. Before the start of the rain in June, this work will commence. All 14 district hospitals and 8 hospitals will carry what we call 3-in-1. 3-in-1 ophthalmology, dentistry, and EMT services. If we do all of that put together, one will start to say, where will the team come from? Who are the people that are going to work in those places? 2 years ago, we started anticipating this. So that as I speak, we are talking about the first 200 batch that are trained from FPCHN to SRN to work in all these hospitals at Sierra University. As I speak, the next 200 from Goma, and Dr. Samai, Professor Samai is here, will graduate. As I speak, 250 midwives are in the system to graduate to serve the service. This is a talk and no government. Please come to the next slide. What we are putting together here is to get the Sierra to feel comfortable, is to get the Sierra to feel safe, is to get the Sierra to believe that when you vote for the government, it is how much service they can give for you. I am getting old. From now, I cannot remember everything. That's what you need to happen. Once we are about to start the rehabilitation of secondary hospitals, we are completing 8 hospitals that we call rural hospitals. For the first time, sir, there will be a rural hospital at Tombo Nimba. For the first time, there will be a rural hospital at Mamako. One of obviously at Woodseed. Another at YPP in Pujol. And far in Faraba at Masabu and Farabata. There are to be 8 of those which Dr. Ali Bukuri will get to the but there are 2 others that I could not get now. Let me say this. 8 rural hospitals to join the one that and the chairman said every month the Ministry of Health is in a position to start a program. I want to say every quarter we will not only inaugurate a forming up. We will not only form the soil for a facility, but we are going to inaugurate one. Every quarter, there will be a facility to inaugurate. 3 facilities in the western area would be ready in 2021. That's at Waterloo, that's at Macaulay Street, and that's at Longleat as well. So, we will be asking you, I'm saying leave for now, asking you every 3 months to have a slot for the Ministry of Health to be able to join us and inaugurate a facility. People have in fact caught on. You now have, as we say, Easter. It's like a beautiful lady, not as beautiful as my wife, but not too much. That company is going to do a facility. But sir, UNESCO is also linked up with the ministry to do a 100-bed facility of Akitizo and Bambara system. UNESCO is going to do so. What we are saying now, people are on now because we believe that the sector is ready to do well. We currently build a nursing and midwifery hospital in Denmark. That should be ready 2021. A nursing and midwifery school. But in this facility, there is land allotted for a nursing and midwifery school for the western area. And we do hope we will get the result to be able to do a nursing and midwifery school there. If this is a village that are going to be in this village. So currently the Vice President of ECOWAS, Madam Ina Koroma, is the one that pushed this program through for the ECOWAS, for the economic, the ECOWAS Bank of Investment and Development to engage the Ministry of Health. We have finished the feasibility study. We have done the preliminary diagram. We have also done full appraisal of the documents. And an $18 million project is to be taken to the board in April of this year, 2021. If you look on the side, the building you see there is going to be the National Blood Bank building. So, don't your eyes to walk there. You cannot use X-ray eyes to go through that building. But at the back of that, we have a vaccine that are going to do oxygen on this side. From the Islamic Development Bank for the equipment that we put in that factory. Sir, beyond this building is where we are going to put a cardiovascular and renal center. Never again will we move our people out of this country for dialysis service. We will engage with us, so in other words, for this one that we now have a corner customer. We have 6 equipment already installed. The reagents would be installed within the month of January, and definitely you will join the incoming minister now to launch the small dialysis unit. I would end by saying that His Excellency has been passionate about radiotherapy and cancer. So to the left again and look at the news. That is where we are going to put the bunker for the radiotherapy service. And don't panic with regard to resources. About $2.5 million from anti-corruption for this program. I have engaged from Mukamata Bansa, and they want you to accept that they include the dividend for 2019 and 2020 $2 million each for this program. By that I mean we require only $4.5 million to build the facility. 2.5 from ACT, $2 million from Mukamata Bank. The therapy center is good. We require 4.5 million to equip that. The 2020 dividend from Commercial Bank, from the $2 million loan that we are going to get from LSP and Israeli company now fulfills the cost for the equipment. What the government of Tanzania has to do is 1.5 million for training in the therapy center. Even that, give a big hand to Her Excellency the First Lady. Even that, Her Excellency the First Lady has already sent out a team of over 8 people, doctors and some of the nurses as well, to start training on oncology. I feel comfortable, sir, that I am now ending and I'm passing the baton to a younger and better known laboratory, Dr. Austin Demi is going to take the baton from me. Tell him to invite me whenever they are going to launch me. I would now put off my hand as a fellow of the Institute of Biomedical Science. And I'm now going to put on the hat as a fellow of the Royal Society of Chemistry. And take my new job as higher and technical education to ensure I continue to support the Ministry of Health and Sanitation. A big hand to investment. Thank you. Before ever His Excellency comes on board to talk to us, let me paraphrase a colleague of ours very well known to His Excellency. Without whom condones something else. But His Excellency condones our duties to reality. So before that he comes to say a few words, let us take some interview. The honorable minister given on to us in terms of figures and facts. So interview please.
So me. Let's make the bad not enough without our. For much so say the corona not in a so you walk on a yard for my face mask no more. From any back on a yard. You didn't know that. Not everyone have corona. Power you must then I on that road. Corona not the woman on that road too. Omega. Ladies and gentlemen, Your Excellency. I am very happy to stand in front of you, Omega. It is very difficult to see the Yangabatical attitude of some of the Sierra Leoneans there. Now, to all of them, what program they come, what would they ready for? Anybody who remember progress, the progress they found. Anybody who remember goodness, the goodness they found. But then the attitude in the salon, not of my business, not of my own daddy, and I'm not busy.
Morning now.
Yeah, now. No say what am I then? God don't give them small appointment. Every day me do nothing again. What did I tell you say me na commerce bank on bank or salon?
Well, you know that I'm ready. And I was on the tell those are you then there. They say na something I'm reading me now. That money why let me that thing. And I thought to God the don't do. Now you make a tell like us me what I want.
No, do that. You want to make a tell you something. For another, I don't say we are not pay them to. But the time when we are they don't begin something in a career.
now we pay the money, we go send up to wait till the cowboy. I'm not saying because the vice president, if they pay your debt, if they don't pay that debt to me now, as bro. What do not do that though? Sometimes you don't do that, and put that away, come on.
Wait, we let her say before the key police get out of this warranted. I'm not a kid engine then do.
What do you mean?
What do you mean?
Oh no! How will you listen to me? What do you mean?
I'm not a kid engine.
Yeah, people that remember development for that program go before that progress can as a rule. You they can't trust?
Okay, like. Okay, wait, see, you know everything? At the end of something, the president, you want to Canada. I don't sort of go, I don't want to say, I'm not a feeling country. Let me not remember that Istava, Isis, or
Isa never win the progress.
See, now Isa, why you don't put on
Isa will win the Mabea. No, come. You know what I say, you know that person. Nobody know the age chokodi. We all go for that question. If they don't get inside the program, all for granted for, now for man is up qualified for me go join inside, now the progress will be oh. I went to the octoide myself, the hockey set, they want they go, no hiding place down there. Oh, I'm Davis. How about you? What about you? No campaign trust, candy American. Now you know what they go and trust. It's not before you reach Joshua meet them upside the trust money. Yes, I meet them to that much you go trust. No, the rest oh, now let's go. They say that people you know they eat, not say about it at all. You say not trust it, Kapana. Equality of speech. What did they come in that way? The government they can't put this area Kenny Town. Yes, I don't know say them they can't open Kenny Town Health Village 300-acre land on Zimbabwe. Yes, the president they got on this today. Yes, I can't come now let me go. The president and cookie that we eat say the president can they cut on my yard. Oh, there was not of my business no more. Hospital. Now 150 bed hospital. Not around one day sweet meal. Then see the whole industry come out and take this one, you put swell the name of Menaya, you don't fly, you have to be in another way. We can't be in one now. Apart from the 150 bed hospital, they get 40 quarter when they make for the doctor them. Doctor I've been taking me. What? Then gets 50 quarter again. When they bill for the lost end. Oh, you know what you make a bloody? They are carrying some eggs here. Not carry go there bring am. They not for there. If I the point don't go. Go accept doctor. No, take no more residence around hospital for the area they qualify. When I just make them they come with an answer they call them carrying some eggs village. Not the question of where they have you don't country anybody can tire. So you know say they actually vast landing. So that's 300 acre. Can you imagine for first 300 acre land? They know easy. Don't they put hospital they do not Punjab that's again the government states like over 200 almost people they go get war. Put the mask first make a thought to people there. We put the mask on. Go fast when you know the mask. I don't know if you watch the smell of a patch. The rest I want to you see so you go up night the town. Hear it? What if make a grade salon man we are all na salon people there. Hear it? Now grade for the development of the part of Brigham. Anybody wanna clap them not the servant. And number two, you know that the one that they talk say the part 200 people there. No, that part can take more than 1,000 people there for working like that. So Mr. Harris, His Excellency the President, ladies and gentlemen, somebody there will go for who creation schedule, but we won't know and will not see her. Hear it? But before they go, this is the road district. And I want to tell Mr. President say, what he don't do now, the people of Kerry Town, Tomo, Fomai, Noti, Somo, Masomo, they all get for benefit. We are putting us together as the zone, the road district chairman, Mr. Aaron, Mr. Aaron, do that now. Chairman, Mr. Chairman, do that now, we let us see you. Mr. President, whatever you go for. Alright, okay. So, Cameroon, that the message will bring down Kerry Town village. Kerry Town, they can get in your hospital 150 dead. 50 quarter for the nurse them. 40 for the doctor them. We all get one side. When for the business, 90 excellence in don't put on balance. We must go with you. I tell my thinking. Now we get here. We are not forget to the computer order they come. We will maintain.
Have come to the apex of our new. Can we just get up and give a big hand to the top and new president? The man who from God brings to the reality. President Julius Maada.
Thank you very much. You can sit down, please. Ministers of government, the executives of Inside Construction and Trading Limited, distinguished ladies and gentlemen, all protocols observed. I was advised to make this remark from my seat, but I know the last time I checked, I so I know in the next 10 minutes I've done myself a lot of good by standing in the sun. Today I want to start off my remarks by thanking all Sierra Leoneans who have rigorously complied with all the healthcare advisories about COVID-19. COVID-19 remains a real threat and it is debilitating and deadly, of course. No one needs to be reminded, but I think some people need to be reminded. Community infections rates have increased lately in Sierra Leone. We've been doing a great job. But of course, as part of the world community, we've had a lot of visitors during the Christmas period, including our own. Therefore, every Sierra Leonean bears the responsibility for keeping his or her family safe, and also community members by properly wearing the face mask, keeping safe distances, and frequently washing hands and using hand sanitizers. We must combat the recent surge. We have been doing a great job, and we must continue to do so for our own survival as a nation. Of course, we have been recognized around the world for the efficacy of the measures we have put in place. And now, with the surge, we must make every effort to reverse that trend. No one can gainsay the massive impact of COVID-19 on healthcare systems all over the world. We have tailored our COVID-19 advice and real-time data. Our surveillance and social mobilization pillars continue to work intensively to detect, track, and inform. We have initiated groundbreaking measures that even more advanced nations have had to replicate in their fight against COVID-19. It does feel good when bigger nations look at a small nation like ours and copy exactly what we have done to be a successful nation as far as our response to COVID-19 is concerned. We have also been recognized internationally for a lot of good things. The MCC has recognized us and made us compact eligible. Many countries to be compact eligible so many years after the MCC was established. We are following through on our promise in the New Direction Manifesto and the Mid-Term National Development Plan to increase affordable access to quality health service delivery. That goal also aligns with a central plan of our human capital development priority, that is access to quality health care, and the Sustainable Development Goal 3 on delivering good health and well-being of our citizens. We will not be considered serious as a nation and as an administration if we talk about human capital without paying due respect to health. And that is why we are not paying lip service to health, but we are actually taking action. We have dared in the past. We have been able to continue delivering increased care for other diseases, even through COVID-19, because of our well-considered and scalable investments in our healthcare system in the last 2 years. For healthcare infrastructure, we have commissioned a total of 308 beds in 4 new hospitals in Kailang, Hanga, Rukupa, and at the Kihama Road. Of course, Professor Will made reference to those. We have also turned forth for the construction of 360 beds in 3 facilities: Jojema in Kailang District, Lower Banta and Upper Banta Chiefdoms in Moyamba District, and 100 additional beds at the hospital. We have recruited and trained nearly 6,000 additional healthcare workers, improved conditions of service for them, and will soon provide diagnostic laboratories in all district hospitals. Development has to be inclusive. It should not be limited to the Western area. And we think that these facilities will bring about a lot of good for the people out of Freetown, and that is why we are making that effort. In 2019, demographic health survey shows better health outcomes for Sierra Leoneans with a 39% reduction in maternal mortality and 19% reduction in infant mortality. But we are determined to continue to give our best. That is the spirit of POWPAD. Many thought it was not possible, but where there is a will, there will be a will, and we are finding a will, and that's how we are delivering even under very difficult circumstances.
We pledged in our manifesto to introduce public-private partnership in health facility management and healthcare service delivery in public hospitals and peripheral health units. At some level, we are already working with private sector partnership to deliver healthcare. We have operationalized the National Ambulance services across all children in the country to support the healthcare delivery. We are piloting a PPP model to support the provision of medicines and medical. As we scale up PPPs in providing healthcare services, let us ensure that there is transparency and competition in how partnerships are negotiated. Clarity about outcomes and the quality of services how the quality of services are delivered, and also effective oversight mechanisms for monitoring, implementation, and funding. As we move toward targets set by the Universal Health Coverage, we have worked on more overarching PPP models for healthcare investment. Australians spend millions of dollars in foreign countries in search of special care services. The minister already made that reference. Every week I sign a lot of documents just we can save more lives by having our own institutions in country. Sierra Leone spends millions of dollars in foreign countries in search of specialty health services because our publicly funded hospitals still need more appropriate infrastructure and equipment and more specialty trained healthcare and other personnel. So it is a holistic approach. We continue to provide infrastructure, we continue to train while working with private sector to provide those services needed for now. What we have negotiated with ESI should make superior and quality clinical service available in country to citizens while adding to the general quality of advanced health infrastructure available in country. The proposed concept of a I'm informed that as per our MOU, ESI Trading Limited will provide 150-bed general hospital that will provide such diagnostic imaging services such as endoscopy, X-ray, MRI, and CT scan. This project will also construct 40 flats for doctors, 50 rooms for nurses, a training facility for medical, nursing, and other allied health professionals, and a 36-bedroom building for people accompanying patients. At the same time, the project will create a minimum of 200 local jobs in the Terrytown area. It is hoped that other management practices here in order to adopt more efficient practices for managing public health facilities around the country. In particular, I am interested in the use of an integrated health management information system that will be used effectively to document comprehensive patient care information that can be used across platforms and institutions for providing more integrated and continuous care for patients from hospital to hospital. It is also hoped that the facility will offer improved quality of care and those services will be affordably priced. It is hoped that with the establishment of this comprehensive diagnostic, radiotherapy, and cancer treatment center within the health village, medical treatment will be reduced drastically. Equally, it is hoped that Sierra Leone will attract patients from the sub-region and beyond, and thus start reaping some of the knock-on benefits of medical tourism. For instance, it is possible to develop a local economy around medical village that caters for hospitality, cultural tourism, transportation, pharmaceuticals, and other associated services. With my government's focus on building this country's human resource base through purposeful reskilling and upskilling, I'm particularly energized by the possibility that our young medical professionals will have an opportunity to work with highly trained professionals in various specialties to use cutting-edge technologies in their practice. This is just one of several for providing innovative solutions for our healthcare needs as a nation. In anticipation of yet another step forward in making available quality healthcare services in Sierra Leone, I am therefore pleased to transfer to the construction of 150 bed hospital facility here in Kerry Town. Thank you all for your attention, and this is the beginning of all of us. Thank you.
Thank you very much. Can we have the national anthem, and that will be followed by the drumming of the song. The national anthem, please. Let us get the last time. The President will now be led by the Honorable Minister to decide on point of the sword, and distinguished guests can also be moved to the side.
So, viewers and listeners, that was President Julius Maada delivering his speech for the construction of 150 beds ultra-modern health facility here at Kerry Town. President and entourage are now walking towards the site where he will be turning the sword for 150 bed ultra-modern health facility here at Kerry Town. It's a walking distance, and so we are already taking the lead here. So the presidential entourage is getting set to move to the site where this all-important ultra-modern hospital is going to be constructed, and the president will be turning the sword. He's been led by the Honorable Minister of Health and Sanitation, well, the outgoing Honorable Minister of Health and Sanitation, Professor Alpha Tijan Wori. as you can see, as the entourage moving towards the site. Come on out. Hello, Council. Sorry. So we are retired Brigadier Julius Maada Bio, and of course he's been led by the Honorable Minister of Health and Sanitation, and of the contractors for the construction of this all-important ultra-modern hospital. I think they want to address the president get set for the turning of the sword. And now you can see he's about taking the shovel, takes it. Ladies and gentlemen, that's the president turning sword for the construction of a 150-bed ultra-modern hospital here at Kerry Town.
I have the honor to turn the sword for this facility, a 150-bed facility, head facility.
President Julius Maada Bio has already turned the sword, and next is the outgoing Minister of Health and Sanitation, Professor Alpha Tijanwori.
Of the power of our dream.
Professor Alpha Tijanwori, outgoing and the contractor, the head of ISA in Sierra Leone, country representative. City.
Present government on
$53 million project. This is exactly how the village is going to look like. It's expected to be completed within 3 to 4 years.
First quarter, we should be there again to inaugurate this time.
So this is divided. Now we're going to have more people coming for daily care. This hospital
Very hard location to find because the house at the end of the Neville Street is precisely a house at the end of the street. It had a few